I've been asked to give this keynote to share a little bit of the experiences of that company, Eleva, which is in several aspects a quite special company, and I will come to that, and what kind of lessons learned could come out of that we could share with entrepreneurs and younger companies who might be on the path of development. So I'm with the company since only 2.5 years, and you will see that the company exists already since a much longer time. The company has been founded already in 1999 as a spin-off from the Freiburg, Germany University. And you will say, well, I've never heard of that company. And that is not a wonder, because the company has been flying until I joined them, has always been flying under the radar, and that was on purpose. But let's look at what we did. So the company took a long time to start with the first part of its activities, which was the development of a new manufacturing platform. So the idea of that, and I come to details later, the idea of that was that at that time it was already CHO or CHO was already the workhorse of the industry, obviously, for recombinant antibodies and other recombinant proteins. But the point is that everybody who ever worked with CHO knows that this technology can be painful. It can be painful with upscaling. CHO simply cannot make some proteins because they are too complicated to fold it, or because they are too big, or other issues are there. And these guys at Heidelberg University, one of the founders, Professor Reski, he's still with us as on our board. He had the idea, well, we take the same process and just exchange the organism. So instead of taking CHO, we take a different organism, and then we want to see whether we can eliminate all these disadvantages. So it took a long time to work on this platform, and I come to details later. And then in the second part of the lifetime of the company, that was still before I joined, the company started to develop assets from that pipeline that were difficult or not possible to produce in CHO. And 2 of these assets are now in the clinic. So that was the second part of the lifetime. And then, like 2.5 years ago, I've been hired to bring the company to the next step, which is, bringing it closer to an exit for the original founders, the original investors. That's basically the story in a nutshell. So the manufacturing platform, as I said already, this is just something that is not meant to replace CHO, but to offer an alternative when you have a protein that does not work well in CHO, or maybe even doesn't work at all in CHO. So basically what we did over the years, we knocked out genetically all the plant-specific glycosylation, for example, replaced it for human-specific glycosylation. We successfully were able then to develop a process of robust large scale. So these plant cells, they grow as single cells, well, filaments of maybe 10 single cells in a row, but this grows very nice in suspension. So we are using as currently largest volume 500-liter standard bags in bag holders from Sartorius. The only difference is it's a plant. We need light in addition. Otherwise, it's exactly the same. We have the advantage because it's cells from plants. You know, plants are, on the one hand, organisms that are always able to do complicated proteins. You know that many medicinal plants are, because of that, medicinal plants, because they are able to produce quite complex proteins or other kind of molecules. And that's what we are using here. On the other hand, also plants have a cell wall, which makes them extremely robust compared to Chinese hamster ovary. You can imagine the difference. So pH changes, temperature changes are possible. So we have, for example, also the possibility to produce proteins which don't like the pH which is necessary for CHO. So all these advantages come together. Plus, we don't have any additives in our growth serum that comes from animal sources, so no risk for viral infections. The regulatory authorities love us for this. And it reduces cost of goods because our plant cells, as a growth medium, they only need water, salt, and sugar, so to speak. So also from that respect, our cost of goods are by default always below CHO. So all these advantages we worked on from the first baby steps. You can see it on the left-hand side of a shaker flask. We went over different technology platforms that we tried over the years. So the third picture is a so-called tube reactor that has 20 liters. Then we went into wave bags that you can see here, a second from the right. That's 50 liter max. So that was a certain roof for volume, of course. Yeah. So now we are here on the right-hand side. This is one of our 500 liter GMP bag holders. We have currently 4 of them running together when we run batches for our clinic. And we are currently working with a well-known CDMO called 3P Biovian. They are our first strategic partner. They bought a license and everything, and they help us to increase our capacity by 4,000 liters sometime end of next year, and more 4,000 2 years later again. In addition, we are talking to 2 more CDMOs for such strategic collaborations in the moment. So, as I said, from this platform came then a couple of assets. 2 of them we were bringing into the clinic. Let's start with what is this? Yeah, that is just about the collaboration. I mentioned that already. So now the first asset that we brought into the clinic is an alpha-galactosidase. And this is a nice story, which was still done by my predecessor, of course. The story is quite interesting because they wanted to start with a large project that has not too high risk. Of course, as a small biotech, you want to start with a not too risky project, but one that is bringing innovation enough. So they wanted to, they picked alpha-galactosidase, which was at that time when there came 2 assets on the market, 2 alpha-galactosidase, one from Sanofi, one from Takeda. They're very similar. And they said, okay, let's do something alike, but let's have me better than the 2 that are the market. And they wanted to rely mainly on the cost of goods as an advantage over these 2 products. But then in phase 1, they had a big surprise. The PK data looked much better than anticipated, and they look better than the PK data that Sanofi and Takeda see with their products in the patients. So we made some analysis and could show that this is based on the specific glycosylation that we can offer. And I don't want to go into the biology here too much, but it's really coming from our platform, from our glycosylation that makes our product better. So now we can say that we have here possible best in class, and we are currently actively out-licensing it. Well, Fabry's disease is interesting. And we are having good discussions here already. But what I want to tell here as a take-home message is that this project changed its character completely over the years. As I said, it started out as a kind of low-risk showcasing project and ended up, without planning to be so, ended up as a potential best-in-class at the end. All right. The second one that is now in the clinic since a couple of months is human factor H, which is maybe, if you remember your textbook immunology, which is the central regulating protein in the complement pathway of the immune system. And in the late 1980s, early 1990s, a couple of clinicians in Belgium and the UK, they found out the role of factor H in these cytokine, these complement related diseases, and could show that these patients, 7 indications in total, that these patients have no functional factor H. So they were able to, these clinicians were able to isolate factor H from serum samples. It was very laborious, not very efficient, very cost intense, etc., etc. But they got at the end enough material to treat a handful of patients, and the results were amazing. That so good results, nobody was expecting that. So the industry then tried to make factor H recombinantly, of course, because the isolation from the serum would never have been flown on an industrial level for commercial purposes. But nobody succeeded. So the industry tried all the different technologies out there, CHO, Neisseria, you name it. Nothing worked. Nobody was able to produce factor H. And then the industry in the 1990s and so started to circumvent it and started to develop inhibitors of the complement pathway, of this specific pathway. And you maybe know these products, C3 inhibitors, C5 inhibitors, and so on. Novartis now brought one on the market. It is working quite okay, and another one has picked citalopram. So there are 2 of these inhibitors now doing the job for the patients, but not so super satisfying for the clinicians, especially because what these inhibitors do, they switch off the complement pathway completely, which is fine. You stop the progress of the disease, but at the same time, you open up the patient for bacterial infections, for a higher cancer risk. So it's not really optimal. And my predecessor, a couple of years ago, he had the crazy idea, well, why don't we try, just for fun again, why don't we try to produce factor H? Because if we succeed, that would be really a game changer in that field. So that was then, in contrast to the first project, a real taking the risk. That was a high-risk project. It was, if it works, fantastic. If it doesn't work, we spend a lot of money for nothing. So this second project was high risk, and it paid out at the end because they succeeded to make the protein full-length human factor H as the only ones in the moment. I like to say it sounds so nice. We're the only ones on the planet who can make this protein. And then we had a lot of very good preclinical data in all 7 indications in animal models where they exist, etc. And we brought it into the clinic now. First, we start with nephrology. These complement-driven or factor H-driven nephrology indications are all rare diseases, which makes, on the one hand, patient recruitment difficult, but we managed that. On the other hand, there are a couple of very nice and well-defined clinical endpoints, which make it easier for us. So the story here is, or the take home for that is, we designed it in a way going first into the smaller indications because of clinical strategy, not because we said that's the larger market. The larger market in these indications is AMD, blindness. Huge market, huge interest by the industry. And we have very good data that it works also in animals to repair the retina of these animals. And that's what we are working for as the large indication. Second step, we will have our CTA ready for filing second half of next year. So that's the second step. We start deliberately with the smaller markets, with the nephrology, but we will get very well, hopefully, these clinical data because of these well-defined endpoints. And then second step, we will go into AMD, which is a little bit more complex, as you can imagine. So the major challenge was here to take the financial burden. So I didn't talk about that yet. So the company has been, throughout its whole lifetime so far, been quietly funded by one investor only. And that's Mr. Dieter Schwarz. So he put half of the money in from his own private pocket and half by some of his different vehicles. But now even for him, this kind of project gets a little bit expensive, because you can imagine clinical development is now blowing up, or not blowing up in volume, our budget. So we get more and more expensive, and we are now restructuring the company also to make possible for other investors to come in. So he wants to have co-investors with that, and that's why we have to undergo a lot of structural changes in the company, et cetera, you can imagine. And that was the challenge coming to the company from this project. So the story behind this project is a deliberate taking of risk. Second, seeing that the possibilities, the commercial possibilities and strategic possibilities that brings for the future of the company, and because of that, then restructuring the company quite a lot to make this possible. How's the time? 3 minutes. All right. So the lessons that I would like to, for those entrepreneurs and young companies who might be in the room that might be interesting are, so we started to invest or if you invest, also to the investors, maybe the one or the other sentence. If you invest, make sure if you invest in platforms, make sure that your platform is scalable. There are many platforms out there, they can support 1 or 2 or 3 projects, but are you sure you can support with that platform projects very broad, that you can get a lot of partners in that are using that platform under license, and you make it available for the industry at large, and at the end make it available, the outcome from this work available for the patients, but because that's at the end is what we all work for, right, for the patient. Then the second point that I wanted to make here is it takes a long time sometimes to translate good academic approaches into industrial scale. For eleva, it took incredible 26 years. It's crazy, and I can talk about over a coffee with you about the details. But we arrived there, and a lot of twists and turns on the road, but a lot of lessons. And now the organization is really weathered a lot of battles. You can believe that, and makes it not weaker but stronger at the end. And it's a very important message that I wanted to shout out here. Start as early as much as possible to talk with regulators and with pharma partners. They have to have you on the radar as early as possible. Yeah. And the other one, I mean, that's a story, a sentence you heard probably a million times, but it's very, very true. You need to have a strategy, and you need to have persistence. Don't stick to your strategy word by word. It will change over time, and I hope you could see that with the 2 projects that I showed here. But be mature enough to change your strategy to the circumstances and persist. Never give up. That's something I wanted to tell you. Yeah, that's it.